Autism Spectrum Disorder by Danielle McGee. This is my daughter, Caitlin Rose McGee, and she was my inspiration for creating this slideshow. She is diagnosed with high-functioning autism, ADHD, anxiety, and sensory processing disorder. Signs and symptoms of autism include poor eye contact, over or under reaction to sensory input, does not speak or has delayed speech or may lose previous ability to say words, does not express emotions or feelings and appears unaware of others' feelings. Repetitive movements such as rocking, spinning, or hand flapping. May perform activities that could cause harm to self, such as headbanging. Develop specific routines or rituals and becomes disturbed at the slightest change. Screening schedule. All children should be screened for developmental delays and disabilities during regular well-child doctor visits at 9 months, 18 months, and between 24 and 30 months. Additional screening might be necessary if a child is at high risk for developmental problems due to preterm birth, low birth weight, or other risk factors. Some tests that may help diagnose autism are Ages and Stages questionnaires, communication and symbolic behavior scales, parents' evaluation of developmental status, modified checklist for autism in toddlers, also known as MCHAT, screening tool for autism in toddlers and young children. Most of these tests and screening tools rely on parent or provider observations or a combination of the both. DSM-5 criteria for diagnosing autism spectrum disorder includes deficits in social-emotional reciprocity, ranging from abnormal social approach and failure of normal back-and-forth conversation, deficits in nonverbal communicative behaviors used for social interaction, ranging from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and bodily language. Deficits in developing, maintaining, and understanding relationships, ranging from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play, or in making friends. Severity is based on social communication impairments and restricted repetitive patterns of behavior. Restricted repetitive patterns of behavior, interests, or activities as manifested by at least two of the following, currently or by history. Stereotyped or repetitive motor movements, use of objects, or speech. Examples include simple motor stereotypes, lining up toys or flipping objects, and echolalia. Insistent on sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior. Highly restricted, fixated interests that are abnormal in intensity or focus. Examples include strong attachment to or preoccupation with unusual objects. Hyper or hypo-reactivity to sensory input or unusual interest in sensory aspects of the environment. Examples include apparent indifference to pain or temperature, adverse response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. Symptoms must be present in the early developmental period. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. These disturbances are not better explained by intellectual disability or global developmental delay, although intellectual disability and autism spectrum disorder frequently co-occur. To make a comorbid diagnosis of autism spectrum disorder and intellectual disability, social communication should be below that expected for general developmental level. As a note, Individuals with a well-established DSM-IV diagnosis of autistic disorder, Asperger's disorder, or pervasive development disorder not otherwise specified should be given the diagnosis of autism spectrum disorder. Individuals who have marked deficits in social communication but whose symptoms do not otherwise meet criteria for autism spectrum disorder should be evaluated for social pragmatic communication disorder. Treatments include applied behavioral analysis, commonly referred to as ABA. Applied behavioral analysis uses the scientific principles of learning and motivation in order to effectively teach. It focuses on the idea that consequences of what we do affect what we learn and what we will do in the future. ABA seeks to improve specific behaviors while demonstrating a reliable relationship between the procedures used and the change in the individual's behavior. ABA uses positive reinforcement to increase more positive behaviors and social interactions, and decrease inappropriate behaviors. ABA therapy is implemented to ensure that each individual's programs are tailored to the individual's unique needs. Analysts will often use assessments such as functional assessment interviews and direct observation to develop an ABA program that is the ideal match and address the individual's specific needs. Other means of treatment are occupational therapy, sensory integration therapy, speech therapy, and picture exchange communication system. Medication may be used to supplement other forms of treatment. Medications can help improve some of the behavioral symptoms of ASD, including irritability, aggression, and self-injurious behavior. Risperidone is the first FDA-approved drug for the treatment of symptoms associated with ASD in children and adolescents, including aggressive behavior, deliberate self-injury, and meltdowns. Aripiprazole is also FDA-approved for the treatment of irritability in children and adolescents with ASD. Additionally, by medically reducing interfering and disruptive behaviors, other treatments, including ABA, may be more efficient. Affected body systems include the brain, gastrointestinal, and sleep dysfunction. People with autism spectrum disorder have significantly increased gray matter volume in the anterior temporal and dorsolateral prefrontal regions and significant reductions in the occipital and medial parietal regions. And for gastrointestinal, 24% have at least one type of chronic gastrointestinal problem, such as constipation, abdominal pain, bloating, diarrhea, or nausea lasting 3 or more months. Sensory overresponsivity and anxiety were highly associated, and the results indicate that anxiety, sensory overresponsivity, and gastrointestinal problems are possibly interrelated phenomenon for children with autism spectrum disorder. Sleep dysfunction. Disturbed sleep is common in children with autism spectrum disorder and can affect behavior and performance during the day. Children who sleep fewer hours per night have lower overall intelligence, verbal skills, overall adaptive functioning, daily living skills, socialization skills, and motor development. Outcomes. Outcomes in individuals with autism vary widely depending on the severity of their condition and when intervention was initiated. Those that have what is considered high-functioning autism can usually learn to live independently and even work jobs in the community with minimal assistance, especially those that have had benefit of early intervention services. However, those with more severe autism may require a lifetime of assistance varying from parental care, group home living, or even institutionalization. Active family involvement in treatment also plays a role in positive outcomes for individuals with autism.